Thank you for watching Truth, Facts, Logic. This video is going to address the notion that much VAERS data is falsely reported by anti-vaxxers or disgruntled family members. A couple things to keep in mind are, first, these are people who voluntarily took the vaccine. At this time, vaccinations are not yet mandated, so they chose to take the vaccine. And the second is that the majority of these reports made to the VAERS system are made by healthcare professionals, and that's what we're going to look at. It is true that anyone can make a report to VAERS, but the vast majority of those doing so are from the healthcare profession. So let's have a look and see if this is not true. We are on the CDC website and we are on the VAERS system. We're going to look for the VAERS ID. We're going to look for adverse event descriptions. We are going to be pulling COVID-19 vaccines. And we are going to be looking for deaths in the United States. So let's hit send. And we should get 3,700 total events, which is what previously I have seen. And what we're going to do here is this adverse event description. We are going to export that information. It will come out once it's done exporting as a text file. So I'm going to open that text file, which is opening now. And I'm going to copy all of this information and I'm going to paste it into an Excel file. So here we have it. All of the information that we just exported is now pasted into an Excel file, and I have created a reporting system that searches for terms. So, out of all the information that we just extracted, look at this, it's very interesting. The word patient is the one that shows up most often in the VAERS reported data. 1,943 times the term patient is used when reporting data. 828 times the word hospital is used. 245 times the word resident is used. Doctor is 128 times. Nurse 120 times. Nursing 109. So you get the picture here. This is all medical professional terms that are in the report descriptions. Over on this side are more family related terms. Family 312 times. Son 199 times. Wife 162 times. So the idea is compare the medical professional terms with the family related terms. This should give an overall good idea as to who's doing the reporting. Most likely, if it says these terms, the report is coming from a medical professional. If these terms are involved, it may be coming from a medical professional or it may be coming from a family member. So grand total of search hits was 4,746. Medical related terms was 3,484. And family related terms 1,262. Medical related terms 73.4%. Family related terms 26.6%. Statistically speaking, this would indicate that the majority of the reporting comes from healthcare professionals. So let's go back to the CDC and let's take a look at some of these event descriptions just to see if it bears true. So the very first one, on December 24th, the resident was sleepy. This report is coming from a nursing home, more likely than not, and stayed in bed most of the shift. He stated he was doing okay, but requested pain medication for his leg at 2:50 p.m. At 2:55 a.m. on 12/25, December 25th, the resident was observed in bed, lying still, pale, eyes half open, and foam coming from mouth and unresponsive. He was not breathing and with no pulse. So the resident, this is all, in all likelihood, a nursing home. Patient had mild hypotension, decreased oral intake, somnolence starting 3 days after the vaccination, and death 5 days after administration. He did have advanced dementia and was hospice eligible based on the history of aspiration pneumonia. So this was a patient, probably hospital, not likely a family member. Vaccine administered with no immediate adverse reaction. 11:29 a.m. Vaccine screening questions were completed, and resident was not feeling sick, and temperature was 98 degrees Fahrenheit. At approximately 1:30 p.m., the resident passed away. So again, we have a resident here, likely a nursing home. This one's a family member. My grandmother died a few hours after receiving the Moderna COVID vaccine booster. While I don't expect that the events are related, the treating hospital did not acknowledge this, and I wanted to be sure that a report was made. So that one was made by a family member. The next one also was made by a family member, spouse. The one after that, resident in our long-term care facility. So it would appear as you scroll through these events that the majority of them are made by healthcare professionals and not so much as made by family members. Remember, folks, truth, facts, and logic. You should be as informed as you possibly can when making your health decisions.